Exercises are supposed to be reducing the risk of cardiovascular diseases, heart attack. But we have also, especially in the recent past, we have seen seemingly fit, healthy youngsters succumbing to heart attacks and other cardiovascular diseases. So, where exactly are we going wrong? Aren't exercises supposed to improve heart health? Or are exercises really bad? Do they cause some sort of heart issues? How much exercise is too much exercise? What kind of exercises should a person do, and how much should that person do? That's what we're going to talk about today. My name is Rajiv Ambat. I'm the CEO and the Chief Health Officer at NuvoVivo Center for Obesity, Lifestyle Disorders and Research. We are an online health and wellness company working with our clients from across the globe and help them manage lifestyle diseases. So we basically help people with diabetes, cholesterol, fatty liver, hypertension, PCOS, fat, so on and so forth, help them reduce their reliance on medications through structured and scientific lifestyle interventions. All right, so let's get back to the topic. When we talk about cardiovascular diseases or heart related issues, we are primarily talking about broadly, this is just for explanation's sake, okay? I will broadly divide heart related ailments or issues to two varieties. One, something which happens because of a bad lifestyle, which has happened over a period of time. So that will be something like a primary hypertension, which happened because of obesity or lack of exercise, a sedentary lifestyle, or something like high serum cholesterol, and hence that high cholesterol leading up to the buildup of plaque inside the coronary arteries, causing the blocks inside the arteries, causing heart attacks. So these are all lifestyle related issues. There could be something which can be congenital, meaning something that a person is born with. For example, somebody having issues such as some of the examples would be DCM, dilated cardiomyopathy, tetralogy of Fallot, valve issues, some issues with electrical conductivity of the heart. These are all issues which are congenital. It is nothing to do with the lifestyle, right? Now we are talking more about the lifestyle aspect of it. If it is a congenital heart issue, you definitely need the advice of a cardiologist, and you need to be in routine regular consultations and then do exercises based on what your cardiologist will say, not based on what any of the fitness experts would ask you to do, right? You need to keep both your lifestyle expert and the cardiologist in loop for those kind of diseases. Now, coming to the lifestyle related aspects, so how does this issue build up? How does this lead? So even youngsters, right? Having a six-pack abs is not the definition of being healthy. Because mind you, a person quite muscular, probably able to do a good amount of deadlift and a squat, six-pack abs, amazing muscular muscle hypertrophy, may have high serum cholesterol or may have high blood pressure. These are all uh, issues which can cause coronary artery diseases. So let's talk about the common one, which is basically the cholesterol forming the blocks inside the heart. So heart is like the size of a fist. You know that perhaps, right? It's on the slightly on the left side of our chest, and that's where the heart is. And it is basically a muscular organ. It squeezes and relaxes. As it squeezes, the blood is pumped out. That's the systolic pressure. And as it relaxes, the pressure drops. That's the diastolic pressure. So that's how the cardiac cycle is. Now, inside this heart is the blood, which is kind of pumped through various parts of the body. But heart is a muscle. And for this muscle to function, it needs blood, it needs nutrients. So there are arteries, coronary arteries, which supplies blood to across all muscles of this heart, the fist-sized heart. Now let's just take, for example, one of the arteries. So there are many major, primarily main three arteries, but let's take one of it for the explanation's sake. Let's take, say, for example, one of the arteries. It's not important, but just for explanation, I'm saying this. Let's take an artery called a LAD, lateral anterior descending artery. It is an artery which supplies blood to one of the main pumping chambers of the heart, left ventricle. So not important, but just for explanation's sake. So let's suppose that. So this is an artery which supplies blood, and let's assume that this area is the, I hope you can see that. Let's suppose this area is the left ventricle, and there is an artery which supplies blood to this left ventricle, right? So this is that artery. Now let's suppose there is a block, okay? There is a block and there is a 50% block, and there is a 50% block in here. There is a block, as you can see there, right? Again, just for explanation's sake, let's assume that this muscle, if there is no block here, this artery will carry 100 units of oxygen, okay, 100 units of oxygen in a normal scenario. But now there is a block, so now this can transfer only 50 units of oxygen, okay, 50 units of oxygen only. In a normal scenario, the person is sitting, not doing anything. This muscle needs only 20 units. So this block is really not a problem yet. Okay. Now this person gets into slowly walking, slowly some sort of exercise, very low intensity, minimal exercises. The requirement is no longer 20, it increases. It increases to maybe 30, it maybe increases to 40, 45, and still no problem, because even though there is a block, 50% block, this artery is still able to carry 50 units of oxygen to this muscle of the heart, right? The minute the exercises become so vigorous that the requirement for this muscle is no longer 50, it's more than 50, that's when this block really starts becoming a problem, right? Now the requirement is 60, but because of the block, only 50 is coming out. So what happens? This muscle is not getting enough amount of oxygen. This condition is called, in medical terms, it's called ischemia. So because of this ischemia, this is called an ischemic attack, or in common parlance, it's called a heart attack. So because of this block, this thing has only 50 units of oxygen is coming. But because the exercise is so rigorous and the requirement is 60 units, this muscle needs 60, and hence there is a heart attack. This is what happens. So what is the takeaway? A person who is having these kind of issues, or somebody who's been on a very long period of sedentary lifestyle, high blood cholesterol, there's a reasonable chance that there are minor small blocks already starting to form, right? Such a person should not go ahead and start doing, crazy, difficult, high intensity exercises. That's just common sense, right? So that's point number one. Now, that being said, this person is regularly, continuously, in a structured, scientific manner doing exercises which requires this muscles, the lateral anterior descending artery, the muscles at the left ventricle area of this heart, requiring around 40 to 45 units of oxygen every day as an exercise, then gradually our heart is so smart that they will create collateral arteries or bypassing arteries. So basically, the other arteries will form on the side to provide oxygen, bypassing this block, right? Pretty similar to how a town will form a bypass roads to bypass the main traffic jammed road, right? The same way. But this bypass formation doesn't happen in a day or two. It probably might take many number of days, perhaps weeks, and even months. So it takes time. So this is how a structured, scientific, sensible exercise, if a person is doing, then our heart is actually capable of producing this collateral arteries and reducing the risk of heart attack. So what happens now if there is such a bypass collateral artery, which heart has formed itself over a period of time? And why did it form? It formed because the person was regularly doing structured scientific exercises, but not overdoing exercises, right? Low intensity, steady exercises. At such a condition, even if the person's requirement goes up to 60, 50 will come through this, 10 will come through this, right? Very simplistic explanation that I'm saying, but I hope you understood the point. I want to actually share my screen and let me show you this deal about the collateral artery. See, as you can see here, there is a narrowed coronary artery, but this is what happens when the collateral blood vessels are formed, right? So exercises will definitely reduce the risk of cardiovascular diseases. But the point here is that structured, scientific, sensible workout is what one should do. Exercises are one of the most anti-inflammatory things that a person can do. It reduces the inflammation. Or most of the things around us are inflammatory. If you step out, the air that we breathe, which comes from the vehicle exhaust, even that is inflammatory, right? The problem with the inflammation is that inflammation is atherogenic, meaning to say inflammation causes the corrosion of the internal arteries. So these arteries which flow, through which the blood flows, the internal walls of that will get corroded. I hope you can picturize that. Will get corroded. And once that gets corroded, that internal walls are a lot more easier to get these cholesterol and calcium and everything get deposited there and form these kind of blocks. And that block, or rather plaque, atherosclerosis, different names for that, will reduce the flow of oxygen and flow of nutrients and causes this heart attack or ischemic attack. So that's what happens. So exercises are helpful, but structured scientific exercises are important. They are actually anti-inflammatory. How much exercise should a person do? For a beginner, we suggest to not do beyond 30 minutes of exercises in a week for 5 days in a week. So 30 minutes every day for 5 days in a week. This 30 minutes can gradually be increased to 45 minutes to up to 60 minutes every day for 5 days in a week. That's a sensible way of approaching exercises. Now, what kind of exercises should you be doing? Broadly, I would divide exercise into three categories. Cardiovascular exercises, any exercises wherein you pant and gasp for breath. There'll be running, swimming, cycling, playing a sport, dancing. All these are cardiovascular exercises. Heavy on the heart, heavy on the cardiac function and cardiac output perspective. Then there is weight training or resistance training, exercises which involves lifting weights, resistance training, gym, and all that are weight training. Third is a yoga, right? All these three has its benefits, but needs to be done depending upon physical conditions of a person. I always keep saying that a person with arthritic knee should not go run. A person having hernia should not go lift weights. So be sensible about that. So if, looking at that way, that's how you should split up and add up exercises together. A person who's having or probably who has already done some sort of an angioplasty and the doctor has already said, oh, there is a 25% block, or the person who's already on and hence on an aspirin or an ecospirin, like how a doctor would have given, it is sensible for that person not to get into any sort of high intensity interval training or highly anaerobic cardiovascular exercises such as mountain climbers or those kind of exercises. So be sensible with that exercises. Instead, you can do other sort of exercises which are low intensity on cardio. And when it comes to weight training, normal, simple weight training is something that a person can do, right? Taking regular gaps and regular rest and recovery time schedule is also extremely important in managing while doing those kind of exercises. Keep a tab on the heart rate. The heart rate is the number of times that your heart would contract and relax in a minute. So number of times heart would beat is basically what a heart rate is. The upper permissible safe net of safe limit that a person can have is around 90%, 80 to 90% of 220 minus age. Meaning to say, if a person is 30 years of age, 220 minus 30 would be how much? 190. Around 80% of 190 or 80 to maximum 85-90% of 190. That's the upper limit that a person can hit while doing any cardiovascular exercise. These days, a lot of modern day fitness watches comes up with these kind of heart rate monitors. So you can actually know what is your heart rate going in, right? Apart from that, common sensical thing, reduce smoking or nicotine in the smoke. Not just the normal cigarette smoking, even the vape or the e-cigarettes contain nicotine. And nicotine is a vasoconstrictor. It constrains the blood vessels. And when it constrains the blood vessel, what happens? Pressure increases. Pressure of a liquid flowing in a narrow tube is commonsensically higher than the pressure if it would flow in a little more broader tube, right? So nicotine constrains the blood vessels, thereby increasing the blood pressure, causing many other issues. So nicotine does that. Also, it corrodes the internal wall, making it a lot more susceptible for the atherosclerosis or plaque buildup and potential chances of block formation, because why? Internal wall gets corroded and inflammation happens, the cholesterol will deposit and the block will gradually form. So reduce the nicotine, reduce smoking, reduce the amount of sodium, salt, processed food and all that, because that also helps to bring down the blood pressure. And generally eat healthy food, reduce processed carbohydrate, reduce transaturated fat. These all will help down bringing down cholesterol levels. Include omega-3 fatty acid in the diet. Exercise regularly. If you're overweight, stay on a calorie deficit, lose some weight. Take weight loss very, very slowly. These are all the things that one needs to do. A person who's seemingly fit goes wrong if there has already been some sort of these block and has tried to overdo beyond his capacity, wherein the block is still there, but you created that ischemia according to the early example that I said. Another reason that the seemingly fit six-pack abs, muscular bodybuilders, succumbing to cardiovascular diseases is because most of the bodybuilders will also get onto anabolic steroids to kind of sort of artificially inflate and makes the muscles bigger. The amount of the muscle hypertrophy or the muscle growth In a normal person, vis-a-vis a person who's taken steroids, obviously the growth is more, and it is artificially induced in a bodybuilder by taking these anabolic steroids. The side effect of these anabolic steroids is that it causes a lot of strain on many of the organs, especially heart. It causes cardiomegaly, increasing the size of the heart. So that also causes a lot and it is highly inflammatory, causes a lot of cardiovascular issues and conditions. Yeah, so these are all the things, and obviously smoking. I already mentioned youngsters with seemingly six-pack abs person smoking regularly can cause a small sort of blocks forming, in irrespective of how sexy he may look, right? So I hope this information was helpful. This is something that some of you viewers had asked me to do a video on. If there is anything else that you have, any questions that you have, would love to answer you. Please keep commenting here. Ask your questions down on the video link. As always, stay healthy, stay fit, stay young, and stay safe. Take care.